Hello. I have a more thorough recording on mobility, but these are the updates for fall of 2022. All right. We use this particular plastic bag in order to add weight, especially to any injured areas in spinal cord. Of course, we'll use that for the cervical fractures or problems. The traction we've used in the past and still do would be the ones with the iron weights. So this is what it would look like if they had cervical traction. And of course, the other one is just an example of skeletal traction. But we're talking about cervical in this lecture. The traction weights. These are the weights that they would normally use, but they're going more into disposable type. Now, because myasthenia gravis, remember, it's a weakness of muscle and different things. And when you're feeding patients, these patients have difficulty swallowing, so as they are prone to aspiration. So we should set up a suction at the bedside, give oxygen if the patient would have any complications, monitor that patient on telemetry. And what you're going to do is hold the next dose of acetyl cholinesterase inhibitor. As far as the cholinergic crisis, I did speak about the cholinergic crisis, but I just want to expound on this one a little bit. I talked more about sludge. Sludge is salivation, lacrimation, urination, diaphoresis, GI upset, emesis. Sludge is not always present, but it does occur in the patient. Another new slide that I added to was the differentiation between the myasthenia gravis and the cholinergic crisis. The myasthenia gravis would be the one with, or the myasthenic gravis, the myasthenic crisis would actually be tachycardia, flaccid muscles, um, pupils could either be normal or large, the skin would be cool and pale, the GI, they really wouldn't have any significant change to the GI. The secretions are not as much. And I did talk about the Tessalon test, and that'll improve the function on a person with a myasthenic crisis because they don't have enough medication. The cholinergic crisis, you would see bradycardia, flaccid muscles, or even fasciculation, pupils that are small, skin would be red and warm, they will have diarrhea and cramps, but they would have an increase in, secretions. With this case, the Tessalon test would worsen, and the reason it would worsen is because you're adding more fuel to the fire. Tessalon, another name for that, is hydrophorium. I'm looking forward to spell it out to you because it may not make sense what I'm actually saying, so I'll try. That's Edrophonium, and it's on your slide under diagnosis. And mainly, Tessalon is used for diagnostic purposes. Thank you.